On December 31st, 2023, my uncle passed away after he wasn't able to receive a liver transplant. His passing is a reminder of a much larger issue, the global organ shortage crisis. With one person passing away every 30 seconds from a disease that can be treated from an organ or tissue transplant, quick measures need to be taken.
In the Philippines, thousands of people are waiting for organ and tissue transplants, yet very few are registered as donors. While campaigning for our cause, we identified three major problems in the Philippine organ donation system. First, many Filipinos associate organ donation with organ trafficking. This is because media coverage mainly focuses on organ trafficking, with governmental organizations such as the Department of Health amplifying these warnings. As a result, this constant fear drives Filipinos away from donating their organ and tissues after death. Some also openly believe that donating organs conflict with religious Catholic values, but in fact, this is not true. The Catholic Church openly supports organ donation, with Pope Francis calling it a testimony of love for our neighbor. Despite this, the conversation around donation rarely happens. It's uncomfortable, unfamiliar, and often misunderstood.
Second, there's very little awareness and discussion surrounding organ donation in the Philippines. Religious and cultural stigmas, a lack of understanding, as well as rampant organ trafficking deter people from registering as organ donors. These are the major reasons why the Philippines has one of the lowest organ donation rates in the world. This brings us to our last point, which is that even if someone is a registered donor, there is no clear indication upon their death. This means that any viable organs simply go unused because a person's organ donor status is not properly indicated when they die. We realized that a visible, personal, and practical solution could change that here in the Philippines. Something people can wear, talk about, and use in medical emergencies. A medical ID bracelet.
The proposed solution is a medical ID bracelet embedded with an NFC chip. We've designed our medical ID through CAD on Fusion 360 and plan on 3D printing them. After our initial market analysis, we have settled on a retail price of 300 pesos. With a simple scan from a phone, first responders or doctors can access critical medical information, including blood type, allergies, medical conditions, especially useful in emergencies where a patient can't speak for themselves. But even more importantly, these bracelets act as conversation starters about organ and tissue donation. By wearing one, people show support, break the silence, and make donation a visible, everyday topic. This combines health functionality with powerful advocacy. Our goal is to distribute 1,000 bracelets by the end of 2025.
We have built a step-by-step roadmap. From July to August 2025, we have secured more sponsors thanks to the Rotary Club of Makati, our first round of funding, which is roughly around 45,000 pesos, and has already allowed us to begin prototyping. In July, we have completed our first CAD design for 3D printing these bracelets. In August, we have embedded the NFC tag into the design and began talks with government health agencies and hospitals. In September, we have launched our beta testing phase with early buyers and partners collecting feedback on comfort, function, and style. In October, we will finalize the design and start our sales campaign, especially targeting youth through social media and other student organizations. In November to December, we plan to enable survey data, identify improvements, and plan the next production phase. Each phase is realistic and based on resources and partnerships we already have. Utilizing the 15 3D printers in our school will allow us to mass produce these medical IDs, enabling us to reach the 1,000 medical bracelet goal. Outside of school, we have also partnered with the National Eye Bank of the Philippines, the Philippine Network of Organ Sharing, and various doctors from different hospitals in Metro Manila. These collaborations provide us with the sufficient connections and resources, ensuring the possibility of implementing a medical ID system.
Sales and distributions will happen at health conventions as well as on our website, which is alaybuhay.org.
We're aware that simply distributing bracelets isn't enough. Implementation needs to be thoughtful and inclusive. Some hospitals in rural areas may not have RFID readers or strong Wi-Fi. That's why we'll also engrave crucial health data directly on the bracelet, ensuring it's usable even without digital tools. For privacy, we're building a verification system so only licensed medical professionals can access full digital data. All users will also sign a consent form, giving medical staff permission to use their data during emergencies. We'll also test for durability and wearability, ensuring each bracelet lasts and withstands everyday use.
To bring this project to life, we rely on project leaders to manage execution and timelines, designers and medical professionals to guide what data is essential, software developers, and medical IT experts to build secure, user-friendly digital systems. And most importantly, students. Through partnerships with student-led groups, we'll design, promote, and distribute the bracelets while involving youth in meaningful public health advocacy. This mix of technical and community engagement makes our team both skilled and grounded.
This isn't just a one-off idea. These bracelets are made using biodegradable PLA bioplastic, which is made from cornstarch or sugarcane, ensuring sustainability when producing these bracelets. It's affordable, 3D printable, and scalable. People wear them, more conversation starts. People ask questions, learn, and eventually choose to support the cause. This creates a cycle of awareness where each bracelet can spark dozens of important conversations. Our partners, including Phil Noss, the iBank Foundation, and student groups, ensure we stay connected to both medical experts and everyday communities. These relationships will help keep the momentum going forward after the first batch is sold.
We'll measure success in 2 ways. Number 1, sales. Our target is 1,000 bracelets sold by the end of 2025. Number 2, awareness. Each bracelet package includes a QR code that links to a short online survey. Respondents will rate statements like, "This bracelet increased my awareness of organ donation," "I feel more informed about tissue and eye donation," or "I would recommend this bracelet to others." This data gives us real insights and helps us continually refine the campaign.
There are real challenges. First, public skepticism. Most Filipinos haven't even heard of a medical ID and may ask questions like, "Why should I get one?" or "How does this help me?" That's why, alongside our bracelets, we'll be launching an educational campaign through schools, churches, and online platforms, explaining how the bracelet works and why it's important, especially during medical emergencies. The second are the legal hurdles. The Philippines has very strict data privacy laws, meaning we'll have to work very closely with the Department of Health and the National Privacy Commission, as well as other legal bodies to ensure legal compliance of our product, even if it means adjusting our designs along the way. Finally, technological limitations in some hospitals. In the Philippines, there has been a long-term issue of some hospitals being way more developed than others, but our bracelets are designed to be useful to all hospitals, regardless of their technological status, with engraved data as a fallback.
If implemented, this project will help achieve SDG 3 Target 8 by improving emergency care through better access to essential health data, and also SDG 3 Target D by strengthening national health risk management through scalable digital health tools. And beyond statistics, we're changing culture, reducing fear, correcting misinformation, and making the idea of donation something personal and visible.